I spoke to Dr. Sarah Hattam, who is a GP specialising in health in the workplace. And I asked her why it's important for employers to consider ways to support staff through menopause.
It should be a huge deal for employers because we know that women over 50 is the fastest growing demographic in the UK workforce. So we have around 4 million women who are aged 50 or over. And menopause is a natural part of the female life cycle. It's a natural part of the aging process. But nonetheless, some women, 25% of women, will say that they experience such severe symptoms that they are negatively impacting them in and out of work. So we have to support these women. We have to create a culture where the M word isn't taboo, where women can talk about the way that their symptoms of menopause may be affecting them, and we can offer appropriate support and signposting. It is a huge deal.
Is the awkwardness, though, because in the past most bosses were men? This isn't something they've had to consider.
Well, I would say menopause is an issue that both women and men need to consider and know about, because you're right, the research shows that there are a lot of barriers for menopausal women in disclosing issues and symptoms related to menopause, especially if they have a male line manager. But even if you're a man, you carry the Y chromosome and you're not in a position of managing female colleagues, the chances are that somebody close to you, either in or out of work, is going to be going through menopause transition and may well be struggling. So it is absolutely not just an issue that impacts women.
Did anything stand out from you from today's discussions taking place in Dorset?
I think what stood out was just the real enthusiasm and motivation for the guys on that call to really champion menopause. That was so refreshing to see, because I think it's unfortunately that is not always the case. But I think the stories that were shared as well, those brave women who came out and spoke about actually how menopause had impacted them, was just incredibly moving. And sadly, as a GP, I hear these stories week in and week out, which is why it's so great that you're running this story and raising awareness. Yeah.
Sarah, it's the start of a conversation, one everybody benefits from. Thanks for your time this evening.
Brilliant. Thanks for inviting me on.